Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Amy Zhang. She is an anesthesiologist, and we're going to talk about her Kevin MD article titled Activism is a Part of Medicine and We Cannot Remain Neutral. Amy, welcome to the show.
Thanks for having me.
We'll get into your article in a little bit. First off, briefly share your story and journey to where you are today.
So I think you could say that I've kind of been living the American dream. I grew up in a low-income immigrant household, and then I did really well in school, worked really hard, and I actually earned a need-based tuition scholarship to Harvard, where I went to undergrad. That was partially based on luck as well. And then I think that kind of changed my trajectory because after that, I was accepted to the Yale School of Medicine, and I also got a joint MBA while I was there. And while I was going through medical school, I fell in love with anesthesiology. So then I ultimately did my anesthesiology at the University of Washington, where I also became involved in, residency activism and advocacy. So I joined the Resident and Fellow Physician Union Northwest while I was there. And eventually I actually became the president of it. And I just recently graduated from residency this past academic year, and now I'm in attending.
So when you were involved in the advocacy roles out west, what kind of issues did you advocate for?
Quite a lot. So we were involved in contract negotiations where we would be representing the residents and fellows of the University of Washington, which is about 1,400 physicians and about 20% of the physicians in King County, which is the county that Seattle belongs in. But the University of Washington has a number of campuses in other states as well. So we would also represent those residents and fellows. In addition to contract negotiations, we also helped provide certain benefits. We also advocated for our own members when it came to, for instance, disciplinary issues or disagreements, or I guess, to put it politely, ways in which our employer may be violating our contract. We would help represent members for that. And then we also became involved in political advocacy, and we were also involved with other inter-union advocacy as well. So for instance, we fought for labor rights. Given the number of things that have been going on lately, we also provided statements, and we also advocated for healthcare justice issues.
So I trained at Boston Medical Center. We also had a resident and intern union as well. So take us into the room where you negotiated contracts with the medical institution. What was that like?
I think it's a lot less exciting than some people may expect it to be. Basically, there's a bunch of people representing your side and there's a bunch of people representing the other side. Usually the proposals and the counter proposals were emailed and shared to each other beforehand, and then you would all discuss each other's sides. And then there were also times where people would, essentially take a break, and you would caucus with your own side and you would discuss how you want to proceed, how you want to strategize. But the most important takeaway that I want to present to people is that contracts and terms in the contracts are not determined at the negotiation table. At the negotiation table, you're mainly just talking about things. Ultimately, what determines whether you're on the winning side or the losing side essentially is how much leverage each side has, how much unity each side has, and how much leverage each side is perceived to have. So when you have a large membership body, that helps. When you have a large membership body that participates a lot in your actions, especially your collective actions, that helps send a message to your employer about whether they can push you around. Conversely, if you don't have high participation rates, if you have members who are more likely to go with the flow or go along with whatever the employer asks of them, even if it's not necessarily a fair labor practice, then you don't have as much leverage at the negotiation table. So ultimately, the strength of an organization and the strength of a union lies in its members.
So give us an example of one way that your resident union moved the needle and improved the lives of the medical trainees.
So we're able to acquire some level of income raises, salary raises, increased benefits. One of the major things that we won was the right for pregnant residents who are in their third trimester and may not want to do 24 plus hour call shifts and for whom it may not be safe to do so, to be able to opt out of doing 24-plus-hour call shifts if necessary.
All right, so let's move on to your Kevin MD article, and it's titled Activism is a Part of Medicine and We Cannot Remain Neutral. Now, for those who didn't get a chance to read your article, just walk my audience through it, share the story, why you decided to write it.
So I think now that I'm finishing residency, I kind of wanted to come full circle, and it's formatted basically as a letter to new interns and new residents who are starting out with advice, both about how residency is. It's essentially drinking from a fire hose, and it's a lot of hard work, but it's also very educational. But it's also pointing out that medicine and healthcare and even basic scientific fact nowadays has unfortunately become very politicized. There's a lot of things that as a person with common sense you would expect to be inarguable, and nowadays they are, even very basic things like how we practice clinically. And I just want to encourage people to be involved in activism as physicians. We have a very crucial role to our patients. We have a very crucial role in the community. We have gone through so many years of schooling and training, and we really see the ground level effects of a lot of policy decisions. And no matter what you decide, whether you want to be involved in activism or not, you're going to be making choices that could be perceived as political or controversial. So really, as physicians, I think we have a responsibility both to our colleagues as well as to the patient community, as well as to the country, to kind of stand up and advocate for what we think is right.
So when you say physicians, it could be attendings or medical trainees, to be more involved with activism. So what are some ways, specific ways that they can do that?
So I think one specific way would be, for instance, if they have a resident union or if they have a physician union, there's attending physician unions as well, to participate in that, since that's a great way for people to organize and to stand as a group to advocate for what they think is right. Apart from that, I think it's important for physicians to raise awareness of issues, to speak out with actual scientific fact, to actually speak out with our experiences of taking care of patients when it comes to controversial issues, especially issues where you may have politicians who have negligible basic biology understanding trying to make drastic policy changes. So I think that's another thing. And I think with the fact that our very basic clinical practice could even be politicized and controversial, I think it's important for you to always do what you think is right as a physician, and, you know, maintain basically the Hippocratic Oath, do no harm, even if it's in the face of absurd political decisions.
So I think what you said earlier about that lack of trust between, or an increasing lack of trust between the public and medical and health institutions has only been growing because of the pandemic. And I completely agree that we in healthcare have a role in trying to restore that trust. So one of the ways that you said to do that was to speak out. So what are some ways doctors can do that? Because speaking out isn't necessarily part of medical training, right? So I think that when they come out of medical school, and if they wanted to speak out against an issue or wanted to push back against medical misinformation, what are ways doctors can do that?
I think one of the very basic ways that we do all the time is basically in your one-on-one interactions with patients, you provide them with counseling and you provide them with information, because oftentimes you have a level of rapport with these patients. These are patients who know you. These are patients who seek you for care and who trust you. And then beyond that, we get into the level of your intimate circle or your close social circles. People tend to trust what their friends and family say. And that's a very easy way, perhaps, for you to bring up certain things, for you to actually say in a non-threatening way, if you prefer, that this is actually what I see. Actually, there's a lot of misinformation out there, and this is the reality, and this is the information I think you need to make an informed decision on this issue. And then going beyond that, then you can have, depending on what level of connections you have, potentially, you can either speak up to the press, you can speak up to various politicians, especially your local leaders, about issues and to help provide education to them. And then if you have a larger organization, whether that's a medical student organization, whether that's an interest group, or whether that's something that's more organized and larger like a union, you can also make statements on the larger part. If you're a member of leadership in any of these kinds of groups, you also have a say in terms of which topics that your organization speaks out on, which kind of statements they release, as well as crafting those statements. And you also have a large role in terms of, whether you collaborate with other groups and how.
Now, what about heavily politicized and divisive issues like gun control or abortion, for instance? How do you recommend physicians speak out against those divisive issues when they know that there's going to be a significant number of the population that may be against their views?
I think the key thing there is to come at things with a sense of empathy and compassion. And then in terms of how direct and how versus how non-threatening perhaps you want to talk about this, I think this is best left up to specific individuals, as well as what they feel is morally right and what they feel is ethically right for them to say. I agree with the major leading medical societies in terms of what is evidence-based clinical practice. I think it's important that we take care of patients and we prioritize the life of our patients and our individuals instead of what specific politicians may be spreading as misinformation, especially since these politicians oftentimes are accepting money from lobbies, whereas usually as physicians, we actually can't do that. I think it's also important for us to keep in mind that, what clinical practice, what is best for the patient is our top priority, not necessarily what any one specific religion says.
We're talking to Amy Zhang. She's an anesthesiologist, and we're talking about her latest Kevin MD article titled Activism is a Part of Medicine, and We Cannot Remain Neutral. So, Amy, for those medical students and residents who are interested more in speaking up and being involved with unions that may be associated with their medical institutions, what are some ways that they can go about doing that and learning more about becoming more involved and gaining the skills to do that?
So I think the easiest way, if you have a resident union, is just to reach out to your union leaders. Usually there's contact info that's easily available, and just ask how you can get involved. I originally got involved with my union as a general board member. So I started out as something pretty low level. And then as I got more involved in various issues, at some point, then the question became whether or not I wanted to join the executive leadership board, and then elections came up and things like that. So it's pretty easy to get involved in your union. A lot of our other union board members actually started out getting involved because of issues like parking or some issue that affected resident life in a pretty profound way, despite how it initially sounds, and then became involved and then gradually became the current president through that. If they don't have a resident union, they can definitely look into forming one. And the thing about forming labor unions is that the actual process on paper is often simpler than what a lot of people think.
My final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
I think the main thing is that medicine is a great career choice with a lot of responsibility. And part of that responsibility now is beyond just mere clinical practice, but also the fact that you should be involved in activism and advocacy. Because like it or not, science, medicine, healthcare are becoming increasingly politicized. They're no longer established as fact anymore. And as physicians who have a role and a responsibility in our communities, to our patients, to our colleagues, it's very important for us to do what's right, and it's very important for us to advocate for what is right.
Amy, thank you so much for sharing your story, time, and insight. Thanks again for being on the show.
Thank you so much.